Welcome to this short lesson on prioritization. I want you to pay attention to everything I would be saying here in this short lesson. Right. It's very important. A lot of students struggle with prioritization. Right. Now, if you are taking the NCLEX exam, right, very soon or later, one thing I can 100% guarantee you is you are going to see prioritization on the NCLEX exam. Now, NCLEX, many students don't know NCLEX is all about the real strategy for passing the NCLEX, because we always used to say NCLEX is all about strategy, but students think strategy come from how do you answer a question. No, you still use your nursing information, right, to answer the question. You cannot lack nursing information and expect strategy to help you answer any question. It's not possible, right? Then you should not be a nurse in the first place, right? It's still your nursing information that you are using to answer every question. But the real strategy we are talking about here is how do you approach the NCLEX in a way that you have that fair advantage to pass the NCLEX exam still in 85 questions. Right, so you need an expert that understand the NCLEX to work this out for you. Now, we have 8 sessions of the NCLEX exam. We call it the 8 client need. Right, we call it the 8 client need. Right, management of care is 18% of the exam, and this management of care include prioritization. Every session includes prioritization, but the prioritization that a lot of students get worried about, which is the who do you first see, right, is the management of care session, right? Like, you are going to get a lot of that on your NCLEX exam. Different prioritization questions, because I don't want to go in depth into prioritization, because prioritization is not only about seeing somebody first. Sometimes you might prioritize the client, 4 clients, right? You might have 4 clients and you need to prioritize who you are going to see first as the nurse, right? Sometimes it's like that. Sometimes you might prioritize the treatment. Sometimes they might tell you, oh, this particular patient want to receive this particular treatment. This particular patient is receiving this particular treatment. So it's not the client we are prioritizing. We are prioritizing the treatment. So we are looking at which treatment is the most important, and we are going to just prioritize the most important one. Sometimes it might be the procedure, right? We might prioritize them for the procedure. You understand? Sometimes we might prioritize based on unit care. Right, because if you're prioritizing based on unit care, the way you prioritize med surg clients will not be the same way you prioritize clients in maternity. Right, there are a lot of things you need to know. That's why I'm telling you, strategy cannot tell you all these things right here. Strategy cannot tell you all these things right here. Because when students see prioritization, I've been coaching for the past 3 years and I'm telling you this. When students see prioritization, the first thing they always used to think is the strategy they will apply. They don't even understand the prioritization that they are doing. In order to prioritize, the first thing you need to always understand is what are you prioritizing. That's the first thing you need to know. That is what will now make you know what to apply. Nursing have the what and what we are going to do. If you don't know the what, how do you know what to do? That is how nursing works. But a lot of students don't even want to know the what, they don't want to know the do, they just want to see that question, right? And then try to fix a particular strategy. And at the end of the day, they now say, oh, I'm using strategy, I'm getting some question correctly, I'm getting some wrong. Why? Because you don't even understand what you are doing in the first place. Sometimes they will feel they say they feel very stupid for getting a particular question wrong. Maybe they don't understand the concept. Yes, because you are not using the right understanding to answer that prioritization question. Instead, you are applying shortcut that is not even you don't even know anything about. Now, I'm going to explain prioritization. The only thing we are talking about is prioritization related to first C. Right, first C. First C means that you have 4 clients, right? First C means you have 4 clients, right? And then you are the nurse right here, and you can see the problem of this client, 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 but you need to see somebody first, right? You need to see somebody first. Now, I'm going to give you a particular analogy so that you understand where what prioritization is really all about. Now, this is you right here, right? Now you have two people right here, and then you have this environment, right? Let us just call it a restaurant. The minimum meal they say here is $10. Right. Now, this person tell you they are hungry. This other person also hungry. You want to help one of this person, but you only have $10. Right. And this is where, if you give any one of them, this is where they're going to go to this restaurant. You only have $10. Now, but two people are like crying to you and they're like, oh, I am hungry. I am hungry. Right. You are thinking of who are you going to help? This is prioritization situation right here now. You see, you look at it, this hungry is the client problem. It is very difficult when you want to prioritize using the problem because the problem don't tell you how severe the situation is. You understand? That is the reason why when we want to prioritize, we look into the situation of the client. So how would you be able to know the situation surrounding these two individual, right? That is when you ask them, you are like, okay, what's going on? Why have you not eaten? When last have you eaten? This person has said, oh, yesterday. Now this person has said this morning. Now, if you are a normal sane person with no recent brain injury, now tell me, who are you going to prioritize in this situation? Obviously, you will tell me this. Why? Because the situation is telling you this person has eaten yesterday. So now you say, you had something to eat this morning, you can wait. This person's situation is severe. So I need to give this person the $10 so that they can go get food. Now look at how NCLEX will put this. Now NCLEX will put, oh, client one, hungry, not eating from this morning. Client 2, hungry, not eating from yesterday. Right. So now when you now see this kind of question, you when I say you want to apply strategy, everything you need to prioritize this client is there. But you will ignore the information and you say you want to apply strategy. Strategy that don't carry information, and you say you want to apply ABC. And then when you are not seeing what to apply ABC on, you now start feeling lost. You don't even know what to do. I've seen people applying ABC to a question that is not even related to ABC. And they are like, oh, they are still lost. They don't know what to do to answer that question. Because this is what they care about, right? The ABC situation. They don't care about the client problem. Right. They don't care about the client problem. And that is bad when you are trying to prioritize. Right. That's bad. You don't care about the client situation. You care about the strategy. That's bad when you're trying to prioritize. When you're trying to prioritize, you look at the client situation. Oh, this client is hungry. This client is hungry. Okay. They are hungry. So what's going on? Say, oh, this client has eaten this money yesterday. Then this client become who you want to prioritize. That is how prioritization works. So it applies true if you are prioritizing real client situation. NCLEX will give you the client problem, and NCLEX is going to give you the client situation. So you are prioritizing based on the situation. Now, the problem you are facing right now, or the problem you should be facing right now, should not be that the NCLEX is not giving you enough information to prioritize. The problem is you don't know how to analyze client situation in a way that it look important for you right now. I've seen a particular student, a client had shortness of breath, and a particular client have increased temperature of 106 degree Fahrenheit. Now, guess what? Because of this increased temperature is very high, this temperature is very high, this student was still confused who to prioritize between this client and this client. I'm telling you, this lady had hard time selecting one of the answers. I don't really know. Increased temperature is high. And shortness of breath, but the temperature is very high. Maybe I should go for this. No, maybe this. You see, If you can be like that, then I can 100% guarantee you 100% fail the NCLEX exam, because this is very clear. The situation is very clear. You don't want to see what the patient is experiencing based on how it has gone beyond the normal, because that is what this student is saying right here, that is giving her hard time. If this temperature happened to be 97, she will not have that hard time. But because of the temperature is now very high, she started having hard time comparing it with a life-threatening situation. I am like, it's not possible that you are comparing increased temperature. They say, yeah, coach, because of the temperature is high and it's very, very high. Okay, it's very, very high. Does it mean that if they put these two people in a race of who to die first, if they put them in a race of who to die first, somebody temperature 106 and somebody has shortness of breath, ask yourself, who will quickly get to dying? Is it the person that's having increased temperature or shortness of breath? So this person don't understand the situation. They only understand their abnormalities. They don't understand the situation. So you don't need strategy. You need to understand the situation. The moment you understand the situation, nothing can get you confused. Because you will see it right now. You'll be like, oh, shortness of breath. If I don't attend to this patient who has shortness of breath, next thing, I will start dealing with a patient who is having low oxygen. And from low oxygen, the all body system get to be affected, and then patient will die. But you see, increased temperature. Increased temperature needs to spend days. Like if it's an infection, right? The infection needs to spend days and move to the blood before it will cause sepsis and death. This one is going to take a long time before patient will get to die. But this one, it can happen within minutes. My goodness. And she was all over the place telling me she later selected temperature as her answer. And I'm like, for real? You see, why? Because they all depend on what? Strategy. If you understand the situation, you'll be able to prioritize right. Now, how do you understand the situation? It all comes from you knowing, because now, when I told you the last time and I asked you, I said, oh, this person is hungry, another person is hungry. You understand that this one ate last yesterday and this one this morning. Now, you decided you will prioritize this person. Why? Because you understand, you yourself have thought about it. You are like, for somebody that have eaten since yesterday, you know the kind of situation they will be in right now. So what do you think? You are like, this person will be severely hungry, this person will be weak and all that kind of stuff. But this person has eaten this morning, this person can still survive. So you understand that it's very severe that this person that have eaten since yesterday will be extremely hungry. You see? That is the same way. How do you perceive if a patient condition is extremely a big situation that you need to prioritize now before any other client? Let me tell you the simple secret. That is when you understand the human body, because this is what you did not focus on in nursing school, right? Your 10 body system. That is when you understand the human body. So you want to understand, how does the neurological system work? How does the cardiovascular system work? How does the respiratory system work? How does the GI work? How does the renal system work? How does the endocrine work? Right. You have your cardiovascular, respiratory, neuro. You have your GI. You have your renal system. You have your endocrine. You have your immune. You have your musculoskeletal. You have your reproductive. Right? And you have your skin, integumentary or skin. Right? You want to know, how does this system work? That's what you want to know. Once you know how they work, their function, the structure, the use of those structure, I'm telling you, when you see something on the NCLEX exam, you will know who's going to die first. Now, you want to know how they work, and you want to know how do they work, right? What are their structure, their components? Those structure, the organs, what are they used for? Now you want to know, how can this particular body system affect other body system? That is even the key of everything. That is the key, because that is how you think about it. Because a patient that is having a particular condition, right? You easily know, right? You easily know You can say, oh, this patient is having this condition, this patient is having this condition, and you'll be like, oh, if this patient is having this condition, based on the disease process, this condition will be the one that we get to client dying. And you say this one can wait. And then you say, oh, this is your answer. Because you see the process at which that problem or situation can lead to dying. Sometimes when we talk about dying, we don't mean that the patient will die within minutes. No. We don't mean the patient will die within minutes. It might take a long time. You understand? It might take a long time before the patient will die. You understand? Like a patient who have infection, before this patient will die, it will take a very long time. It will take days. Right? But patient that's having shortness of breath can die within minutes. So you are not prioritizing maybe that question you are trying to answer, maybe infection is the correct answer in that question. Does not mean we are saying the patient will die immediately, but we are just using our nursing knowledge to say, oh, with this situation, this is the problem we need to deal with now. Sometimes we don't even think about dying. We think about the immediate complication the client will have, because sometimes they will not die now, but they will have immediate complication that will be very terrible to fix. Right? We think about the complication because complication occur first before dying. Now, you see all this concept I'm telling you, right? I can teach you all this concept, but you need to firstly understand this, which I can guide you through, right? Understand the body system so well so that when you see prioritization question, you are going to forget that no BS way of answering prioritization questions. Strategy is not what you need. You need clear understanding, because you will still use this clear understanding when you start working as a nurse. Would you start applying strategy when you start working as a nurse? No. You need a clear understanding. You want to see a particular situation and don't be thinking which one will be the answer. The moment you start thinking which one will be the answer, I can 100% guarantee you don't know what you are doing, because you need to be clear. You don't need to overthink it. You need to not say, oh, okay, a patient have shortness of breath. All right. A patient have increased temperature. Okay. All right. This is the closer to dying. You don't need ABC to know that this patient is the closest to dying. You just need to understand the body system, because if the respiratory system is affected, right, cardiovascular system starts suffering from it, neurological system starts suffering, then death. If the renal system is affected, renal system have to affect any of these three body systems before death will occur. Same with GI, endocrine, immunocompromised, all these problem right here, all these other body systems, they need to affect any of these three body systems before death can occur. But how quick are they going to affect this body system? That's what you want to learn, because it is how they are going to quickly affect that those body systems that can kill the client that you are looking at when you are reading the prioritization question. Oh, this patient have bleeding. Some people don't even know how to prioritize bleeding. Bleeding is by the location. We always used to ask the where, and we always used to ask, is there a bleeding that is caused by trauma, right, or expected source? Like if they tell you a female client is having heavy menses, this is not this is not a priority. But because students heard that keyword heavy, they are like, oh, this patient is bleeding heavy. It's not a priority. This is expected source. Ladies experience this every month. It's expected source. Before you will prioritize how heavy this is, you need vital sign that is showing that this patient is having low blood pressure. Before you prioritize this, it's not a priority. But if they tell you a patient is bleeding from the head, sometimes students will say, oh, patient is bleeding from the head, it's dangerous. But sometimes the NCLEX might say it's just cap. Because of this cap the NCLEX said, it means that it's not priority. It's not priority. Patient is bleeding from the hand. Oh, the patient is bleeding from the hand. But you can just apply pressure and the bleeding will stop. It's not priority. So how do you prioritize bleeding? Right, I've given a lot. Right, if you want to understand how to prioritize, I have this part of my coaching program. If you are struggling with the NCLEX exam, you can join my coaching program, right, and then have access to successfully passing the NCLEX exam, moving from being confused and now being a licensed nurse when you walk out of the exam center. I want to help you out, right, in passing the NCLEX exam, but you need to invest in yourself, right? So I want you to visit my website, this is futureRNPN.com/intensive. right, slash intensive. So I'm also going to put the link below description, right? So futureRN.com/intensive, right? So you are going to see everything you are going to get when you join my coaching program, right? If you want to ask me any other question, right, maybe before joining or something, right, just reach out to me, +1 767 613 0769, +1 767 613 0769. Just reach out to me. You can reach out to me via WhatsApp if you are using WhatsApp, or iMessage, right? iMessage for iPhone users, right? WhatsApp, if you're on WhatsApp, this is my number. iMessage, right? You can just text me, right? Or go directly to my website to join the coaching program. When you join the coaching program, right, or when you are about to make your payment, it will ask you for your phone number, right? It's very important, because that is how I'll be able to text you. Once you've made the payment, I'll be able to text you and be able to guide you for 8 weeks. The coaching program is for 8 weeks. Just go on the website. You are going to see all the details. I go on the website. You'll be able to read everything related to the coaching program, right? And if it's something that you want, definitely join. And I will see you on the other side of success. Right. With that being said, I'm going to see you in the next one. Bye.